A legally authorized representative, or LAR, is someone who is authorized to consent on behalf of a research participant. The role of an LAR is to provide or maintain informed consent during the life of a research study. An LAR may be needed when a research participant lacks the capacity to provide informed consent, or if their capacity to consent could diminish during the course of a study. There are three main benefits to appointing an LAR. 1. It respects participant autonomy. Having an LAR respects autonomy by making sure participants have a say in who makes decisions about their research participation on their behalf. 2. Risk management. Researchers may reduce legal risk by discussing and documenting participant wishes regarding an LAR. And 3. It enables research participation. LARs may enable an individual to participate in research even when they're not able to provide informed consent. In addition to these benefits, studies also show that a majority of older adults and adults with Alzheimer's disease support the idea of letting an LAR make research decisions on their behalf. So you might be wondering, what's the difference between a study partner and an LAR? Study partners are commonly required for Alzheimer's disease or dementia trials. Although the role of a study partner may overlap with an LAR, they are not the same thing. The role of a study partner involves assisting a participant with transportation to appointments and serving as a source of information about the participant. The benefits of formally appointing an LAR still apply when the participant has a study partner. Consider asking participants if they want their study partners to also be LARs to clarify their role. How do you decide if an LAR is necessary? Let's find out. Not all studies need an LAR. Here are some questions to guide you as to whether an LAR is necessary for your study. 1. What is the risk level of the study? According to the NIH, when studies are complex or the risk is higher, then LARs may be needed. 2. Are your participants at risk of cognitive impairment? People at risk include older adults and people with certain medical, neurological, and psychiatric diagnoses. 3. If your participants lack capacity to adequately understand a complex clinical trial protocol, might they have the capacity to appoint an LAR? Appointing an LAR is a much simpler decision than consenting to a complex clinical trial. Even if a participant lacks capacity to consent, they may have capacity to appoint an LAR, enabling them to take part in research. And 4. Is your study a one-time interaction or is it longitudinal? A one-time interaction might not require the use of an LAR. In contrast, a multi-year study where capacity to consent may change over the course of the study may justify asking participants to appoint an LAR. Answering these 4 questions will help you determine whether your study would benefit from inviting participants to appoint an LAR. Check out our video on helping participants appoint an LAR to learn more about how you can incorporate LARs into your consent process.